is kind of behind that. So Mexico has had plenty of warning, as did the United States, to try to figure out how to tackle this issue. And of course, our leaders are making decisions on the go, because this is an evolving crisis. And I think Mexico is very much along those lines, with the advantage that Mexico is behind those other countries and perhaps had ample warning to take some important measures. And of course, another inbuilt advantage to Mexico might be that the country is coming at the tail of this problem. And by the time it gets really critical, perhaps scientists will already have come up with vaccines or treatments and on and on. And of course, factories will be reconverted to produce what is needed to treat this problem. And so Mexico may benefit from that. It will, of course, depend on government action and the ability of the government to make use of this advantage. But that is to be seen. For now, Mexico is about a month, almost a month into this crisis. The U.S. is a little longer, and of course, other countries have been in this quite longer. So where is Mexico on these 4 items that I just outlined for you that I think are important to consider? Well, on messaging. I think, as I mentioned, Mexico had a very important warning from other countries. Mexico was, of course, quite ahead of the, or rather, I want to put it the other way, at the end of this. That is, other countries had already been through the experience and Mexico was coming behind. So that gave the Mexican government a good opportunity to craft a message, a good, effective message to spread among the population, and to begin to allow the Mexicans to adjust to social distancing and craft the importance of this. And I really don't think that the Mexican government was very effective in doing that. It took a very long time for the message to come out. Eventually, the Susana Distancia, which is kind of healthy distance type of a play on words, came into play, and now it's spread in social media and so on. But one thing is the message that is being crafted by the specialists, the Mexican doctors and epidemiologists, who are very good at this, and I think they're a competent team. And another thing is the fact that these messages have to be filtered through the political environment today. And I think that is where the message hit a snag. I think the problem was not crafting the message and spreading the message. The problem was political, because Mexican authorities, especially at the federal level, did not collaborate carefully with getting this message out in time. In fact, Mr. López Obrador's own behavior, I think, sent a mixed message very explicitly. He told people to go out and engage socially, and of course, he discounted the importance of the virus, the dangerous nature of this threat, and then eventually he's going to come around. But even then, kicking and screaming, dragged by the serious circumstances that are now beginning to emerge in Mexico. So even then, he sort of vacillated on the message, and I think that's been a great disadvantage. The team in charge of this response, Mr. López-Gatell, who's an undersecretary for public health, has been the leading figure in trying to deal with this pandemic, and I think he's quite competent. I think his experience stems from the H1N1 pandemic in 2009, and I think so he's got this experience behind him, but obviously he's got some political weight that he's dragging, and I think it's impeding him to act as I think he would like to do so. And that is, again, the political filter that has not operated in Mexico very well. The good thing about Mexico is that, as I said, the problem showed up a little bit later, and I think many Mexicans took their clues, or their cues, rather, from other countries because of social media and the internet and so on. Mexicans very quickly learned what other countries were doing and the problems they were facing, and social distancing and so on. And so many Mexicans began to adopt measures even well before the federal government issued any guidelines, which were only issued yesterday, March 31st, and that I think is a problem. But many Mexicans were already behaving in a way that might actually aid and contain this problem. So in that sense, I think that the Mexicans are quite connected, especially the upper and middle class. Even though some of them, especially in the upper class, that traveled abroad on vacation and came back and brought the virus and were accused of being super spreaders and so on. But regardless of that, I think many Mexicans who are well connected to the world quickly understood and began to spread the message of what needed to be done on the part of society. Social distancing is now the norm, and it seems that it's so far the most effective measure. The government has finally sent that message clearly and published some guidelines, even though they're presumably not that clear on social distancing. Enforcing it, though, is going to be very difficult. There will be people who have some savings and income and can work from home, but a majority of Mexicans, many millions, 56% of the economy is in the informal sector. These are people who live hand to mouth. And sell goods in the streets and stands and so on. It's going to be very difficult for them to practice social distancing. And I think in many places in Mexico, people are going on with their lives because they understand that the virus can come, but they also understand that otherwise they have no food on the table and no means to get it. And that, I think, is going to be an important problem to enforce social distancing. There simply cannot be an enforcement, even though some states like Yucatan have tried to do that by imposing fines and even arresting people. But it's going to be very difficult because many Mexicans simply cannot isolate themselves. They got nothing at home. So that's going to be quite difficult. Of course, this has to do with law enforcement and social unrest. Will the state be able to not only enforce social distancing, but also cope with a lot of people who are in need of supplies and that will go out of the stores, out to the streets, or perhaps even, as we've seen in some places, little spots here and there already organizing themselves via the internet to loot in stores. That has not been a serious problem, but it's there. It's already happened, and I think we have to keep an eye on that because it is quite possible that the government will have to deal not just with enforcing social distancing, but with containing the probability of social unrest. If people see themselves in a crunch and they see no other option but to go out and make a run on stores and shops and so on to get what they need. So that is, I think, is an added problem. On economically, I think it's also an important problem in Mexico. Obviously, as I just mentioned, many individuals in Mexico work and operate in the informal sector. These are people that operate stands in the streets, sell things in the streets, work as day laborers and on, home housemaids and so on, and they don't have the income, they don't have the savings to isolate themselves. So presumably the state will have to come up with a plan. The elderly and vulnerable and less able individuals will also need government help. And what shape will this take? What form will this take is still uncertain. President López Obrador has, of course, promised that social programs will continue to take care of the elderly and the vulnerable, but I'm not sure that the budget will give. And I'll say more about the fiscal straits that Mexico will find itself in a minute. But I think it's important to think about that. Of course, the issue is that because Mr. López Obrador has had a very hostile relationship with the private sector, he has not been able to muster the political clout and the ability to call on the social sector to craft a strategy from the from the private sector, the economic sector, to aid in this problem. He's had a very controversial relationship with the private sector. There's a lot of mutual suspicion. So I'm not sure that he can build a consensus with the with the economic sectors of the country. That I think is a serious market problem, but it's also a political problem, obviously. Now, will Mexico be able to guarantee that all that is required in the market be there, that all the supplies, the supply chains are not disrupted? So far, we've seen plenty of goods in supermarkets and the streets, but there are little spots here and there where people have run out of supplies, particularly cleaning goods and hand sanitizers and paper and so on. So we've already seen, especially along the border, partly because people are crossing the border from the US to buy these goods or were crossing. There are more restrictions now, but I think that's something that we need to make sure that is there, the supply chains. So far, so good, but I think Mr. López Obrador will have a very tough time ensuring that there is a more comprehensive strategy beyond the health strategy, the public health strategy, and ensure that the economic actors in the country collaborate on this, especially if they have to keep their employees in the payroll and send them home at the same time. There are already some measures being taken in Chihuahua, for example, to reduce the salaries of public employees. They're not very happy with a reduction of 50%. But there are such measures that have to be taken in the private sector as well as the public sector, and yet they're not there yet, and people may not be very happy if they see their salaries reduced, the payroll reduced, and unemployment, of course, skyrocket. So that's going to be an issue. So far, we have not seen a radical redirection of the budget in Mexico. I think the country is still pursuing three major infrastructure projects: the Santa Lucia Airport in Mexico State, the Mayan train, which is a train that goes around the Yucatan Peninsula, and of course the Dos Bocas refinery in Tabasco. The government is funneling a lot of money, a lot of cash to those projects. And of course, Pemex is now in serious trouble. Producing 1 barrel of oil in Mexico, it costs roughly $14, and yet in international markets, the Mexican mix is about $10. So Pemex is already operating at an incredible deficit and loss. And so this is really, really an important issue, and it's going to put a crunch in Mexico. Add to the loss of revenue through the oil sector, which Mr. López Obrador was counting on, ramping up production and then higher prices to be able to have the resources. The fact that the tourism sector has collapsed. The tourism sector in Mexico is very important on the beaches and so on. Clearly, about 8.7 to 9% of the Mexican GDP depends on tourism. Tourism is drying up very, very quickly. And of course, that is going to represent a major crunch on employment, but also on income, and of course, also on state revenue, as the government cannot collect taxes from businesses that are simply not operating, not having any economic activity. And yet the government so far has refused to redirect the budget to sort of create or craft some restructuring in the federal budget. Eventually, I think this will have to be done. How exactly and what money goes where, we don't know yet, but this is something that is coming up. The other issue, of course, has to do with remittances. We know that Mexico last year, I think, received $36 billion in remittances from immigrants in the United States. Many of the immigrants work in economic sectors in the United States that are being hit by unemployment. They're probably among the first to let go in the United States. And so their income is down. And of course, the money they can send home to Mexico is probably going to be down. And that's going to be a big issue. So Mexico has been hit on all kinds of fronts. And eventually, I think this is going to create some serious fiscal problems, and the Mexican government will have to review the federal budget and where money is going to go. But Mr. López Obrador has so far resisted even talking about that. He's proceeding with these projects, and of course, he's proceeding with the budget as he views it and the social programs as he wants them. But it's going to be something that we have to be looking at in the future. Unfortunately, he's already spent about 60, maybe more than 60% of the stabilization, the rainfall fund or the fund for rainy day, that is, that had been accumulated over the last 10 years. He's already gone through that. He's burning very quickly through that cash. So Mexico is not going to have the kinds of savings that will be required to face a potential fiscal crisis. So that, I think, and budgetary crisis, of course, that's going to be an important issue that they'll have to consider. On healthcare, what are exactly the kinds of things that are happening in Mexico? The reality is that the Mexican government finally put in place a consensus on gathering the numbers, the number of infected individuals, the number of suspected cases, and the number of deaths due to this virus on a daily basis. They're being posted every day at the end of the day. However, because there is no aggressive testing being done in the way that, say, South Korea did it for a while and has been doing it, we don't really know how many cases there are in Mexico. There are now hot spots throughout the country. In Monclova, for example, almost 40 employees of a hospital were under contagion, a few deaths. In Baja Sur as well. So there are some places where this is beginning to show up, but there is no systematic gathering of the numbers yet. So the statistics, I think, are underrepresenting the problem in Mexico. And I think I'm not saying that this is done on purpose. It could simply be done because they just don't have a system to gather systematically, to report the data systematically and make it available to people. But I think it's very important that the Mexican government systematize the data, the data gathering, and of course the data presentation before the people. Otherwise, there's going to be a lot of confusion. People are going to think that they're not at risk because the numbers are low, and yet they are at a higher risk than the numbers would say. The numbers could be kind of a signal that of the dimensions of the problem, and I think the Mexican government is not very effective at doing that. Stockpiles, I think, of protective gear are very low in Mexico. Obviously, in 2019, the Mexican government underspent by the public health budget by 60% or so. There were already all kinds of protests throughout the country because doctors and hospitals and nurses did not have the gear and the supplies and the drugs and the machines that they need in the hospitals. There were already, even before the crisis, there were already protests that the public healthcare system was underfunded and undersupplied. And of course, this is creating additional issues because now they're seeing cases of coronavirus show up and the Mexican government does not have the supplies. Last week, the Mexican government authorized the purchase of some of this equipment and drugs and so on in the international markets, but it's too late. We know that everybody's competing for the for what's out there. I mean, everybody needs protective gear, masks. Everybody needs drugs that may ameliorate the issue. Of course, everybody needs ventilators. So clearly, I think the Mexican government is a little too late on that. The number of beds also in Mexico are way below. Certainly, Italy has a number of beds. The U.S. has half of that, and Mexico is even less than that, a fraction of that. So if there is a surge in individuals who require hospitalization, the hospital system is simply going to be overwhelmed, even worse than it is, I think, in the United States. And that is going to be a very serious issue that I don't think the Mexican government has carefully considered, or, as I said, considered a little too late. So we don't know what the dimensions of the problem are, and I don't think we're going to know. And we cannot recruit the private sector and the universities and others to do the work of collecting this information because everybody's isolated and everybody's increasingly shutting down. And of course, the private sector and the government have not had the best relationship. So there is obviously a problem there. The government did deploy a model. It's a model that shows the curve, a steep curve going up very quickly, but obviously a model is only as good as the assumptions that are behind it. And I think in the beginning, the assumptions of the Mexican government were very optimistic. They may have to get a little bit more pessimistic as time goes by, and I think they're adjusting, they're making adjustments to the model. But obviously, this is a big problem the Mexican government will have in its hands. They're not collecting the data fast enough, systematically enough to know exactly how that curve is going to develop, and I think that's going to probably feed distrust in the government as more Mexicans realize that their experience differs from that of the government's numbers. So that, I think, is an important problem that Mexico has and will have in the future. There is obviously very little research going on in Mexico. There are some individuals who are very creative. Some universities there are trying to do some research to work with creating equipment, and there are some good faith efforts here and there, but we don't know what they are, and we don't know where they are, and we don't know how they fit together into the larger strategy. The larger strategy is still not very clear, as I mentioned, and so individuals may make an effort, but if this is not a component of a larger strategy, I think the problem can only get worse. And of course, we have a political problem, which is kind of a more general distrust among certain segments of the public, the private sector, and the public sector, and so there are some political issues that need to be resolved there. Of course, I do want to say something about the population in Mexico and the vulnerable. It seems that this virus, although it can certainly be very dangerous for young and healthy individuals, it is quite dangerous for people with pre-existing conditions, diabetes, high blood pressure, heart conditions, and obesity, and so on. And of course, Mexico has very high levels of all of these vulnerabilities. So its population is very vulnerable to this virus, and there's very little that can be done to protect them. Many of them economic actors that live day by day, and they have to come out and work. And so I think Mexico is perhaps not more population vulnerable than Italy, because the Italy had an important quarter of the population above 65 years old, but certainly Mexico, for other reasons, is quite a vulnerable population to this problem. And so it seems to me that is going to be to magnify the impact of this virus if we do not look ahead a little bit. The political measures, I think, are very important to know, because the government took a whole month, practically the whole month of March, to look into this and not look into this, and to debate among themselves, and call on the National Public Health Council to try to put together a strategy. This is an important institutional mechanism that Mexico has and made effective use of in 2009, because it took so long in trying to figure out how to proceed, and there was a lot of disagreement even among individuals in the federal government. I think in the end there was no political consensus. There should have been a very hard political consensus building behind this, with governors, with mayors, with the private sector, with other organizations in the country, and call them together into this council to session, and to get their feedback very quickly and put something in place. And it's simply not there. So the governors were on their own. In Jalisco, they relied on testing. In Monterrey, in Nuevo León, they relied on social distancing. In other states, they relied on other measures in certain cities, and so on. So everybody appeared to be on their own. It was only yesterday that the government issued some serious guidelines, and even then, I think when you read them, they're not that clear as to exactly what the behavior, how these measures translate into an actual individual behavior. So clearly there's still some work to be done, some specificity to be crafted on this, so it'll take a few more days, and hopefully it will not be too late. But I think there was a lot of political work that needed to be done, and it needed to be done a month ago, even before with that advance warning that the country had. And of course, there's always counterproductive actions and statements by political actors. I mean, the governor of Puebla, Mr. Barbosa, for example, said that the poor were immune, that this was a disease that hit the rich. And of course, that's not helpful, because there's a lot of poor people in Puebla, in his own state, for example, that may then say, oh, our governor says there's no problem, and they're going to come out and they're going to get infected and then spread the virus and so on. So these are not helpful political messages. I think this is where political discipline is also important. We've seen this kind of lack of coordination in other places, but certainly in Mexico, still going on. So a lot of political work to be done also in the next few days. I want to mention a few more things before I address some of the questions that Enrique has and some of the questions that are coming in on the screen. Mexico, this particular pandemic, this particular public health crisis comes at a very difficult time in Mexico. Particular vulnerabilities that are more structural. Most of what I said right now has a lot to do with government behavior, with actions, with anticipating, with acting, with choosing, with deciding. There are other important structural problems that Mexico has that I think are quintessential to look at and are going to be very important to keep an eye on over the next few weeks and so on. One has to do with healthcare reform. President López Obrador dismantled a popular federal decentralized health insurance program called Seguro Popular, in which the federal government gave the states a certain amount of money to insure a certain amount of poor people who then were tended to in the state's hospitals and the hospitals around that particular state. He dismantled because he didn't like it. He distrusted it because it was done by his political rivals in the past, and instituted instead the what he calls the Institute for Health and Well-Being. This was a catastrophic rollout. It was a very poorly implemented public policy. The guidelines were not in place. What was covered was not clear. Where the funding was going to come from was not clear. And of course, he centralized this new program in the federal government, distrusting the states, and the governors protested and the governors resisted. And so there was a lot of pulling and hauling at the political level on this issue. And so clearly it is a problem. I think that many individuals in Mexico don't know if they're covered, if they're not covered, where to go, where not to go, and so on. So this problem comes exactly at a time when the Mexican healthcare system is in the middle of a major transition. And that is not very helpful. I think it could have done better. It could have been executed better. And I think it could have helped. But for now, I think that's where Mexico is. That's where the system as a whole is, in the middle of a transition, and it's going to be very difficult to figure that out. The other issue is, I think that Mr. López Obrador continues to handle these things in a very personalistic way. Mr. López Obrador is a very powerful person. He knows himself important, and he thinks he has to be very close to the people, and he travels and he likes to shake hands and travel, use the airports and the planes and be in touch with the people. And I think that's a problem. And then of course so his personalistic politics are getting in the way. And of course he recently said that his adversaries wanted him to be isolated so that they could take advantage of that and increase their power. I think that's an unfortunate statement, but that's part of his personal politics. The other issue that I think is important here is, of course, the scientific issue. The scientific community and the public health community and the research community are not integrated today. They're in flux, and of course, everybody's sort of running to isolate themselves. So there's no major effort on research that we know of, and the private sector, the pharmaceuticals and the equipment makers and so on, they're all kind of not quite integrated into a general structure. So that is a key issue that I think is also going to affect the government's response to what's going on. So to conclude, I think it's unfortunate that Mexico did not use this warning, about a month and a half, perhaps, of warning to get this done. But it is what it is. That's where Mexico is. Lots of things to keep an eye on over the next few days, few weeks, and we'll come back to these issues and see how they develop now that the government appears to have acknowledged that there is a problem and that they will need to tackle it differently than they did in the past month. So thank you for listening to me. I think now Enrique will come in and we'll have a conversation. And I will also take some of your questions from the screen in a minute and try to address some of them. So thank you. Enrique, please go ahead.
So my name is Enrique Sara. I am a graduate fellow for the Center for the United States in Mexico at the Baker Institute, and I am also the host of the center's podcast, Mexico Center. And in it, I have had several conversations with our center's director, Tony Payan, about Mexican politics and the binational relations. So this format is, we're used to it. So I have several questions here and some that are coming in. But first, thank you, Tony, for your analysis of Mexico's response to the COVID-19 pandemic. I think you hit some of the key areas of what a government's response should encompass and how Mexico is doing on this front. I have some questions here I wanted to ask. You already touched on some of these issues in your presentation, but I thought it would be a good opportunity to perhaps expand on them, or for those who are just joining us, they can hear some of your answers to those issues. Perhaps we'll address some new ones as well. But to start, what is your overall evaluation of Mexico's and perhaps more specifically the Mexican government's response to this crisis? Mexico has had a relatively few diagnosed cases of coronavirus. Why is that, and how does this factor into how we evaluate the government's response?
Yeah, I mean, I think that some of the strengths of Mr. López Obrador as a politician are now not serving him well. I think that he obviously was very effective at crafting a message around the issue of corruption, at practicing the politics of division and clivage, creating adversaries and enemies and rivals, appealing to the poor in close proximity, almost physical proximity, visiting all kinds of places and on and on. And of course, calling the upper middle class and the upper class and the well-educated fifi, kind of a pejorative term, and so on. Well, none of this is now serving him well at a time when he ought to be sending a message of isolation, confinement. Of course, that goes against his own instinct and, of course, what he's been doing throughout the month of March. So that's not serving the message well, because what you want your leaders to do is to act the way they're asking people to act. You don't want your leaders to ask you to do something they're not doing. And so that is not, I think, in many ways serving him well. His suspicion of the business sector and the scientific sector and the facts and the hard data, because he said that he has other data, meaning he doubts statistics and data. That's not serving him well either, because what we need at a time like this is transparency, hard data, and decisions made on science and data. And that's not going very well. And of course, his politics of division and cleavages and creating enemies impedes his ability to craft political consensuses with the rest of society. And he's been doing that even just a couple of days ago, continuing to attack his rivals and enemies and on and on. And so that's also not helping him a whole lot. So clearly, what are his quintessential political assets are now liabilities. And I'm not sure that, because he's a stubborn man, he's convinced of what he believes, that he's capable of actually shifting gears. And in that sense, I think he's undermining himself. And I attribute all the debates inside the administration and all the issues that they've talked about and all the disagreements that they've had and that have delayed their response to those characteristics of the president. And even today, I think there is still some disagreement inside, and it is reflected by the guidelines that came out that continue to be very unspecific. So in some ways, I think that's probably the origin of this rather delayed and hopefully not ineffective response, but I have my doubts.
So international media has considered Mexico's response to the crisis to be careless or not determined enough, as you've mentioned it as well. They portray Mexico as not being ready or not taking enough action when they should. And I think a lot of this criticism comes from what we have seen Mr. López Obrador do, and as you have commented, right, that he has continued to hold rallies or shaking people's hand, kissing babies at these rallies, encouraging people to go out to the street markets and restaurants and so on. Considering this focus, but also what is happening parallel to this, what are some of the major issues that the country's response to this public health crisis?
Yeah, I mean, obviously, Mr. López Obrador is convinced that the international media have not given him fair treatment. He has also said the same thing of critical media in the country. Yeah, perhaps the media, some media, not all of it, obviously, there's media on both sides. There are media on both sides, have been unfair or not, we don't know. I mean, what we do know is that he, in my view, from my perspective, Mr. López Obrador is not receiving any less of a flack than previous presidents. Calderon received a lot of criticism, and Peña received even more criticism, especially towards the end of his administration, because of corruption and the inability to resolve the Ayala students' disappearances and so on. So I don't think it's any different. And of course, Mr. López Obrador and his supporters also gave a lot of criticism to those previous administrations. So I think that they consider the treatment that they're receiving in the international media and the national media is unfair, but the reality is that they gave then as much as they're taking now. So I don't think it's any different. Besides that, I think we ought to consider that a healthy, strong, and critical media is valuable to democracy and to liberty, and it is also very important so that you keep your feet on the ground and that you consider critical and alternative perspectives in calibrating your own response. So you shouldn't see it as they don't like me, they're dealing with me on an unfair basis. On the contrary, I think that you could turn it into a strength and say, we're going to take the criticisms, kind of evaluate them on their merits and see if they are helpful so that we can use them to calibrate our response. So I don't see it that way. I just think that obviously Mr. López Obrador has some populist penchants, and part of populism is, of course, a complicated relationship with the media. And he's going to view it that way. But I don't see that has changed in any way. And he's got plenty of media who are on his side, both more traditional media like La Jornada newspaper, and of course less traditional or online media like Paul Lemon, who's very faithful, loyal to him. So clearly, I don't see it that way. I think they're also missing an opportunity to strengthen their reputation as respectful of the media and criticism, and then taking criticism as part of the input into their decision making.
So we have seen how the healthcare systems in European countries such as Italy and Spain are struggling to keep up with the spread of coronavirus. There are major concerns here in the United States that the healthcare system will also struggle. Is Mexico's institutional and physical capacity to deal with the crisis up to par?
Well, there's two answers to that question. One is no and maybe. As a whole, no. I don't think that, I mean, Mexico has only a fraction, perhaps 10% of the number of beds for every 1,000 people than Italy has. And we've seen that Italy has completely been overrun and overwhelmed. And we've seen in the United States also experiences in New York and New Jersey and other places where public spaces like stadiums and convention centers have had to be set up as kind of ersatz or makeshift hospitals. Mexico doesn't have enough hospitals. It doesn't have enough personnel. It doesn't have enough supplies, enough drugs, enough of anything. So the overall answer is no. And then, of course, you also have to break it down. Do people in the rural areas of Guerrero state have the same as people in Monterrey, Mexico, for example? No. There are many more hospitals, doctors, and nurses, and physical capacity in Monterrey, and Guadalajara, and Mexico City than there are in many other regions of the country. So the physical capacity to tend to this problem is not evenly distributed. Some people have more, some people have less, some regions have more, some less. I think the numbers overall, if you take the country as a whole, the answer is no. But if you take item by or region by region and item by item, I think some are better prepared than others. I'd rather be sick in Monterrey, Mexico, and have private insurance or access to a private hospital than be sick in rural Michoacan or in rural Chiapas, where I am certainly almost, it is almost certain that I will not have the requirement. So, but I think the answer overall is probably no.
So while the pandemic most clearly is a matter of public health, the measures that are needed to slow the spread of the virus have a significantly negative impact on the economy. What are the economic and fiscal consequences that you expect Mexico to go through as a result of this pandemic, especially taking into account its major sources of revenue?
Well, I already mentioned some of them, right? I mean, the major mistake that I see here is not that Mexico doesn't have enough resources. It's not a poor country, even though, a lot of people say, well, Mexico doesn't have the resources, it doesn't have the revenue. There's probably going to be a revenue crunch, to be sure, because economic activity is slowing down. But it is a rich country, and I think there are resources. The problem is how do you use those resources? I have a similar question on the screen from somebody, and I can tell you that I think the very first thing that the government ought to do is stop throwing money at the major infrastructure projects, which are already very questionable from a financial perspective, from a viability perspective, and so on. There's a lot of the federal budget that's going into these projects. You gotta hold off on those things, and you gotta figure out if you're gonna need that money for something else. You're also going to go into the international markets, and you're going to have to buy a lot of these goods probably at a higher price because everybody's competing for these goods. So you're going to need those resources. And of course, Pemex is now operating at a negative. As I mentioned, a barrel of oil costs about a little over $14 to produce, and the Mexican mix is at $10.37 as of yesterday. So you got to figure out if you need to slow down Pemex operations or to focus, slow down those where you lose money and focus on those that you actually get money from and so on. Because it's, again, the revenue from Pemex is not distributed evenly. There are different places. Some are operating at perhaps at a with a surplus, others at a deficit. And so you have to figure out, so you have to be smart. And then you have to say, what is not absolutely necessary? And how do we channel money to the hospitals? The government last week began to recruit lots of doctors and nurses and scientists that it fired when the López Obrador administration came into office. They fired all these people, and now they're asking them to come back to the healthcare system. Those are mistakes that are very costly. So I think that in the end, there's got to be a fiscal response, and everything has to be on the table. All of these different things have to be considered all at once, especially because, and this is the second part of the answer to your question, you're in an oil crunch. You're not getting revenue from oil. Tourism is collapsing. You're not going to get that revenue from tourism. And then remittances may collapse because Mexican migrants are being laid off or furloughed in the United States, and they're probably not going to be able to send money to their families in Mexico. So you're getting a kind of a triple punch, in addition to the fact that the revenue in Mexico is probably going to shrink. And so all these different things, you have to consider them. And so if I were an advisor to the administration, I would say, hey, let's put everything on the table. Let's consider where we can save the money, what we can stop, where we can contain losses, where we can refunnel money, and so on. I don't see that the administration is doing that just yet. He insists in financing his projects. He insists in pushing through with Pemex. He insists in giving these cash handouts, which have been criticized for lacking rules and transparency and on and on. So they have to go back to the drawing board and they have to redo this. They haven't done it yet, but I think that would be an important part of doing it. The only thing they've said, and they've been very clear, and I think it's a mistake, is that nobody's getting a tax break. Not small businesses, not large corporations. No one is getting a tax break. Well, a lot of these companies are going to get a tax break by the sheer fact that their economic activity is going to get depressed and the taxes are based on their economic activity. That means revenue will also shrink. That's a problem. I think the economic side is not, in the financial and fiscal side are not being handled well, not yet.
There's a similar question that we're getting in terms of the financial markets, and it says the international financial markets are becoming increasingly negative on Mexico. What is the likelihood of a failure on the banking system and Mexico defaulting on its international obligations?
This is a major problem. Look, Mexico's ratings have been downgraded for a while, for last year, almost a year and a half since Mr. López Obrador took office. Everybody gave him the benefit of the doubt. Everybody thought that he might kind of react, and his presumed austerity and fiscal discipline were an exhibit in the beginning of his administration. So things were going kind of well, and I think that many people said, well, of course, his major mistake was to cancel the Mexico City airport project. And then, of course, the recent, and I think illegal public referendum on that beer plant in Baja California, I think was a mistake because he keeps sending the wrong messages. And so he keeps being downgraded. If Mexico finds itself in the position of having to resort to the international markets, the interests are going to be higher. The money will be there. Mexico may be able to get that money. Washington has already offered to have some money available for Mexico, but that's going to be very expensive money. And that's gonna compromise income in the future. So you are shooting yourself in the foot by sending the wrong message, by picking fights with the private sector, with the international markets, the media, and of course, canceling important projects that people saw as symbolic. You didn't have to do it. I mean, but I think Mr. López Obrador has not yet woken up to the fact that he is going to need to resort to these markets, and he's going to end up paying much more money in interest for that money.
So I wanted to ask you about the U.S.-Mexico border. What is going on in this regard? What can we expect? On the one hand, border crossings are severely limited now. And on the other, you have a migrant population that was already in precarious conditions. And added to this, another question that we're getting, they want to, what's your opinion on the possibility of total closure of airports in the upcoming weeks?
Well, let me address the airports and then I'll come back to the border because that's a more complex question. The airports, I think it was a mistake. This is the kind of things that Mexico should have been stricter in the beginning. You may remember 3 weeks ago or so that President Trump in the United States announced a ban on all travel from Europe, even though American citizens and residents could continue to pour into the United States, perhaps even carrying the virus, and so that may have been a problem. But in the case of Mexico, 3 weeks ago, or even less, the government was still inviting tourism, even from Europe. And so Europeans were still coming in, people are still going to the beach, and so on. I understand why Mr. López Obrador did it. He's balancing the economy, economic performance, and he knows he depends on that with the pandemic. But inviting people and not making sure that the airports become an important bottleneck to impede the entrance of compromised individuals from compromised countries, or have checkpoints to ensure that you capture the people that may have problems and from entering into Mexico. Not having taken those measures will cost a lot. I mean, a lot of these individuals that are infected have already come into Mexico from Europe and from Asia and other places. I looked at the planes map, the flights that are still going on. There's still thousands of flights going on, in and out, and so on, even in the United States. So clearly, I think it was a mistake. It should have been a very first step to take to make sure that less contaminated, some contaminated people were going to get through, but less contaminated people did. So I think in the end they're going to have to close the airports. But so far, they're resistant to do it, and I understand why. Balancing an economic crunch. Contraction in the economy, which is now expected to be 7%. I think that'd be a good number. If I probably, just my intuition tells me that it may be even greater than 7%, but I think I understand why they're doing. The U.S.-Mexico border. The United States implemented first measures. U.S. Residents and citizens could still travel into Mexico and back. And that meant a run on goods, paper, cleaning goods, sanitizers in Mexico. And it left borderlanders on the Mexican side without those products. They first ran out in San Diego, El Paso, and on, and now they run out along the border in Mexico. But Mexican citizens holding a visa, especially the B1, B2 visa, which is a card that borderlanders use to cross back and forth, were not, were not allowed to cross as of today. So activity is reduced. In El Paso, Texas, for example, it is estimated that traffic on the international bridges is now 60 to 70% lower than it was. And now they're becoming even stricter on the rules. So the U.S. is allowing U.S. citizens to go, but you have to have a really good reason to cross the border. So there's even a crunch on U.S. citizens and residents today. You have to justify the reasons. You can't just cross because you're a U.S. citizen. So activity on the border is slowing down. We have news that trade has not slowed down. However, another analysis behind it says that a lot of what is crossing is existing inventory because maquiladoras are slowing down, production activity is slowing down. So what is actually crossing, even though it's not sensibly lower, is really what was already there and ready to cross. So there may be a crunch on binational trade, and we may see a problem on the border. The number of cases on the Mexican side remain low compared to the number of cases in California or Texas and so on. We don't know if it's made a difference not to let people come in to Mexico by the U.S. authorities, not by Mexican authorities, although some measures are beginning to be taken. But perhaps because we're not measuring, so we don't really have the dimensions of the problem, as I mentioned earlier. The border is going to be a complicated place, and of course you have the issue of migrants stranded on the U.S.-Mexico border, waiting for their day in court in the United States. U.S. immigration courts have slowed down. These migrants are in encampments or in refugee shelters on the Mexican side. They're going to stay there for a very long time. There are some efforts now to relocate them to hotels and homes and isolate them and take care of them, and some of them to just send them home, give them money to go home. But they can become quickly a very hot spot of this problem. So yeah.
So to wrap up, there's a lot in Mexico's response right now that seems to be misguided, slow, and or not determined enough. But I thought we should try to end on a positive note if we can. So I wanted to ask, what do you see as some silver linings here?
Yeah, I mean, there are some issues here. Look, everyone was very pessimistic about not everyone, obviously. I mean, half of Mexicans and a lot of the international markets were very pessimistic about populism coming into Mexico and about Mr. López Obrador, especially after taking that decision to cancel the Mexico City International Airport project. So there was a lot of pessimism, and everybody thought that Mexico was making a turn for the worse and so on. I see a little silver lining on this. I think that perhaps a lot of Mexicans, and Mr. López Obrador's popularity is slowing down. I mean, it's coming down bit by bit. It's now just under 50%, haven't been as high as 80%. So a lot of Mexicans are beginning to reflect and are beginning to think that the best way to govern the country is through political equilibrium. And so I think that in a year or so, a little bit over a year, when Mexico will have elections, I think we're 14 months away from the elections. Many Mexicans may actually say, hey, we'd better not give the entire cake to a single political party and a single political figure like Mr. López Obrador. We need to rebalance the country politically. So there may be an opportunity for the opposition, if they can actually capture that opportunity, to make an entrance into the stage again, and of course a renewed faith in checks and balances in Mexico. So I think politically there may be a good correction, which many of us thought that might or might not occur. This virus may actually get us into a little bit more of a political correction. That's, I think, one thing that is probably a good note. The other one is, of course, that Mexican society has acted on its own. As I mentioned earlier, Mexicans were taking their cues from Europe and the United States and taking measures and doing certain things even before the government. The Mexican society and some local governments were ahead of the federal government in trying to figure out what to do. And I think in that sense, it's really, really very important that we think that Mexican society has a long experience in self-organizing, self-mobilizing. It's capable of responding on its own without the government. We saw it in 1985 with a major earthquake in Mexico. In the absence of the state, Mexican society stepped in and did a good job. And we saw it even in 2017 when there was another major earthquake, and Mexicans organized into chains to rescue people, to distribute food, to create public order, to find people, to connect people. And so in some sense, I think the Mexican public may discover that they don't depend on the government, that they are able to, I think, to do a number of things on their own. So those are, I think, potential things. I hope that it also entices the López Obrador government to put aside some of its political, I guess, political tactics, so to speak, that I mentioned earlier, that are not serving him well, and try to create broader consensuses and a broader understanding of what's going on in Mexico. That one I'm not sure is going to happen that easily, but at least I think there is something there, and everybody will understand that society needs to be solidarious in solidarity with each other, and that Mexicans need to organize with or without the government. And that's probably a thing that Mexicans have already shown in the past and can do again.
Well, thank you, Tony Payan, Director for the Center for the United States and Mexico, for answering these questions and for the presentation about Mexico's response to the COVID-19 pandemic. And thank you to everyone who's watching live or who may be watching at a later time. We invite you to check out the website of bigcareninstitute.org and see our future events or the publications that the center has put out.
Thank you, Enrique, and thank you, everyone. It's a pleasure. Bye-bye.